I'm at True North, by the way,
I
in case you wondered why there's a bed in the background.
was curious about that. I was like, oh, that's an interesting background to choose.
Yeah, when I don't have my Chef AJ screen, it's because I'm not at home. And I'm not at home. I'm at the True North Health Center. Hey, everyone, and welcome to Chef AJ and Friends. I'm your host, Chef AJ, and my friend today is my friend. And he doesn't live in California anymore, unfortunately. And his name is Dr. Matt Lederman. And he's been my rock, my moral support since being diagnosed with lung cancer. And he's here. He is a doctor, but he's here mostly as a friend because every few months I have an update on my treatment because either I have a PET scan or a CAT scan or something to share. If you really want an in-depth following of my cancer journey, the best thing to do is subscribe at help at chefaj.com because every Sunday I send out a heartfelt little email that's usually kind of cleverly written and funny about what I'm going through. But every now and then we don't really have big news, but we have news. And please welcome Dr. Matt. And you are no longer a resident of California. That's very sad for
Um,
me.
I know. It's a bittersweet move, leaving some people we love very much, and also connecting with people we love very much. So too bad
Well,
everybody can't live all together. That's what my daughter said. Why can't everybody just buy a house next to each other?
oh my God, that's so sweet. Well, here's the thing. Most people want to get out of New Jersey. I remember Dr. Joel Furman finally, when his youngest son graduated high school, moved to California, but you actually went to New Jersey.
It's funny. People are saying that to me. They're like, "Who comes from California, New Jersey?" But we're in Princeton, New Jersey, and really liking the area. I love all the green and the big trees, and it's the bigger, more land, and it just helps my nervous system feel more open, and it's very green compared to more brown in the desert like areas. So I'm enjoying it. But I also like the seasons. I miss sunny every day after a while. It gets old, but maybe after one winter I'll be calling and crying. So
That's funny. I never think getting sun every day gets old. But also, you were in Southern California, and Matt, there are parts of California that are quite green and that almost have seasons.
which parts are you
Where I
thinking of?
live in Northern California, I mean, there's snow, it gets cold, and we have lots and lots of trees that aren't brown.
Yeah, yeah. Well, you should have told me that before I moved. It's
I thought I, I
little
thought
late,
I
a little
thought
late.
I did. I have a feeling though, you'll be back.
I think so. We're always moving around. I have a friend that just picked up and said, "Oh, we're in Italy." I thought they were visiting, but they just moved. So it's just, some people like to move around, explore new areas. I think that's fun.
Yeah. So, I'm not a
What
doctor.
about you though? Do you like to move around, or are
No,
you more of are you roots like a tree, or are you like a bird where you sort of,
no, I'm not like a bird. I'm like a tree that never wants to be uprooted. And I've got uprooted a lot in my childhood, and that's probably why. But I've moved, I think, 4 times. In the last 7 years, we've moved one, two, three, I think 4 or 5 times. And I'm like the dog at the shelter, still looking for their forever home. But I do think Northern California is a really good area for us, because there's such a large plant-based community. It is really cold. And so I have to weigh what Dr. Lyle calls my social ecology of having a lot of friends with my physical ecology of being cold about 6 months of the year. Ideally, it would be good to have two places, but I don't see myself as having two places because you gotta have two air fryers and two Brevels, and it seems like a lot of money and work to have to maintain two households.
yeah, that's what do you do without, a couple of, you have to have an air fryer and everything. How many are there, like, key appliances that you're like, we gotta, these are
I mean, for
like
me,
air conditioning?
For me, it's the Breville air fryer and the Instant Pot pressure cooker, a quarter bigger. Those are my main two that I use. And of course, it's always nice to have a high-powered blender. And I think people really need a food processor, but I could get along without a blender. I could not get along without a food processor.
Yeah. And what the Instapot, that's pretty important to you?
Yeah, it doesn't have to be that brand, but yeah, pressure cooking is how we get food on the table fast. But also my new fun appliance is the Ninja Creamy Swirl, and I do love it, especially in summer, making swirled ice cream quite a bit in the flavor of strawberry. So but those are not necessities, but I do feel for me an air fryer and an Instant Pot are like that's like the bare minimum for a kitchen where you're going to be eating healthy every day and doing batch cooking.
Yeah, I like it. Okay. Good
Do
to
you
know.
have none of those?
Um, we don't use the pressure cooker, but I as much, but I'm wondering what am I missing here? What do I need to make that I'm not making?
Well, the pressure cooker makes steel cut oats and oat groats even in 5 minutes, which is great, and corn on the cob in 0 minutes. And it's so I love just being able to make soups and stews and chilies, throwing everything in, pushing a button, and not even cutting anything up. So for me, it's like I don't know how people live without an instant pot because then you got to cook everything on the stove.
Yeah, no, that's maybe we'll try it. In fact, yeah, I'm here. I came here because my father is 20 minutes, 20 minutes away, and it's nice to be around some, family and my family. Alona's family actually was in LA, but it's been over 20 years since I lived on the East Coast, and I grew up on the East Coast. But he said he's got this Instapot that's never been used. I don't know if it's Instapot, but a pressure cooker, never been used. And he's like, "Hey, do you guys want it?" And we said, "Oh, we don't really use it, but now maybe I'll have to go back to him." And so he's not using it, I'm not using it, and you're saying it's like a key
We use
tool
it
that
every
I'm like, what
day.
are we missing here? I'm like, oh my God.
We use it every day. We never don't use it. I mean, Charles has steamed greens every day for breakfast, and it's like it takes just like a minute or so. I don't know how people live without one, to be honest. They're so easy. You can do everything in them. You know, you can steam your potatoes. You can, I can make artichokes in like, 5 or 6 minutes. I think they're fantastic. And I get nothing from the company because I don't even think the company exists. I heard Instant Pot went out of business or was struggling.
Really?
But I make all my soups like, my cauliflower bisque. I take this gigantic can of yam that weighs 2 pounds and a huge head of cauliflower that weighs 2 pounds and an onion that's huge that I'm not cutting up and peeling it and putting it in with the spices and the water. And I cook it for, 10 minutes and I put my immersion blender and I got dinner. It's like there's
Wow.
no fuss, no must.
Well, I just as we're here, I'm sending a text to my dad. I'm like, Dad, I need that Instapot back.
Yeah,
So
I'll get you my Instant Pot cookbook. It's very easy. So all you guys watching, are you on Team Instant Pot or do it on the stove, the old
yeah, we
fashioned?
should do a survey to everybody watching who has a pressure cooker and who does.
Yeah,
See, what do you think? If you had to guess, what percentage of your viewers have
I,
a
I
pressure
would
cooker?
say at least three-fourths. I can't imagine that.
Whoa.
I can't imagine if you've ever watched me for the last 15 years that you still don't have a pressure cooker. I'm like, how do you cook? I don't know. I can understand maybe not having an air fryer, but you got to have a pressure cooker. Yeah.
Oh my
And
God.
Hey, Dr. Nikki Davis. And by the way, Dr. Nikki Davis isn't just a brilliant plant-based doctor and just a pretty face. Dr. Nikki Davis is a comedian doing her first set in front of a large audience, and I mean large, like 400 or 500 people in Vegas a week from Saturday. So tickets are pretty much sold out in person, but you can buy a virtual pass and watch Dr. Nikki Davis do comedy and Dr. Joel Furman, myself. So I'm not, but that's what's great about comedy, Matt, is I'm not thinking about cancer because, well, I'm more nervous about that right now, just doing a good job. And not that it won't be funny, but I didn't realize because it's been 7 years since I performed, and I've never performed comedy in front of 400 or 500 people. It's been in a club. There have been like 50 people, and they've been
Wow.
drinking. And when people are drinking, it's great because then they laugh. Vegans don't drink for the most part. It's certainly not, there's not going to be any alcohol at this conference. And it's like, oh boy. So I didn't realize, and kudos to all these actors to memorize their lines. How much is involved in just memorizing, a 7 minute set? It's a lot. If that's the hard part, is trying to remember your material.
Yeah. So you have to just keep saying it over and over again, and then
Yeah. So
it's
what I
probably
do
not
is,
funny like the fifth time
oh,
you've gone over it with Charles, right?
it's never funny. And, all of us comedians have been working together on Zoom to try to catch up to speed. We have our big dress rehearsal tomorrow. And, the acts are great, but when you've heard them, like you say, 20 times, it's like, so hopefully it'll be funny to the audience. Mine is about cancer. And so when I started, I don't think people realize because I didn't share my diagnosis with anyone until it's been less than a year. I've known about it since September 23rd of 2022. So I'm going on 3 years of cancer. You guys are going on less than one with me. And so I started early on, doing jokes about it in class. Not I haven't done any clubs, and people were like, because they were so sad. But I think the fact that I'm alive 3 years later, that I don't look sick, at least to most people, that I have a lot of energy, that hopefully they'll laugh. And it's not about, I'm not making fun of cancer or people with cancer. I'm making fun of my own experience with cancer and especially about the things that people say to you when you have it that are just, I think it's funny. And I mean, I hope it's funny. You just never know. Doing
Mm.
anytime you go in front of people, whether it's doing a YouTube video like this or giving a presentation. They say that public speaking is the number one fear. You take a risk, but if you have a life without risk, you have a pretty boring life. So I'm going to
Right.
take the risk. And, I said to Dr. Lyle, I said, please, can you and Dr. Goldhammer sit in the front row and tell me, what you think honestly, other than don't quit your day job. Because, I'd like to know, like, you know, it's probably too late for me to have a career as a comedian, I'm guessing. But I'd like their professional opinion is, am I funny enough? Like, could I have been a contender? Like, remember Marlon Brando on the waterfront? Could I be a contender? I don't know because I never put the time and the energy needed to be great at it. But I'd like to do that now because when I am doing comedy, I don't think about cancer. I think about cancer a lot. Every little ache and pain. Right now, I'm dealing with some really bad pain in my chest, which isn't necessarily cancer. It might be a Keytruda side effect. But when I'm in comedy class, which is as often as possible, stand up improv, or when I'm writing comedy, I don't, it's like I'm in my happy place. I don't think about it. Like not even for a second, not for a
Yeah.
second. So
Yeah. And
that's,
it must feel so nice to have that relief of that space in your brain of
uh,
not,
it's so
not,
fun. The time that you and Mark came up and we had that private in-person class, because like you say, nothing beats in-person comedy. It's just that you can't find it everywhere. So Zoom is better than nothing. But it's so fun. It's so creative. And I just think laughing in general, whether you're laughing at yourself or somebody else, is the most healing thing. Hey, it worked for Norman Cousins. Why can't it work for me? I know there's things involved with the T cells. Something happens with the immune system when you laugh.
oh my God. Yeah. And it's same thing with crying. It stimulates the parasympathetics and the relax and your physiology shifts. And, you're not, it's almost like you can't, um, play and be anxious. When kids are playing and laughing and you can't be anxious. Your body can't do both at the same time. Your whole physiology shifts just from laughing. In fact, have you done those therapies where you pretend to laugh and you just keep laughing with people and then all of a sudden
I haven't done it recently, but I have taken laughing yoga and I know what you're talking about.
laughing yoga? I've never heard of that.
Yeah, it's like where you're like it's funny because what you're like when people laugh, it's contagious and you start laughing.
Wow, that's interesting. Laughing yoga, like everybody's just doing downward dog and
Oh,
laughing
no, I don't know.
hysterically.
I don't think you're actually doing poses. I took it a long time ago in Connecticut at one of the Veg Fests. I don't remember, but I know there was a lot of laughter. And I don't watch scary movies. I don't watch the news. I mean, I don't watch very much at all because I don't have regular TV. But when I do spend time viewing, that's what I do is anything that's going to make me laugh because that's what feel. Cheryl, hi Cheryl. Laughing yoga is the best. I just saw the movie Naked Gun, and it's like there was one scene. I love movies where like they're so funny that you're not just laughing, but you're like peeing in your pants laughing.
Yeah, oh my God, that's fantastic. But I'm gonna have to look into this laughing yoga thing.
Yeah.
So now I gotta get a pressure cooker and laughing yoga. My list is getting longer.
If anybody knows anybody that does laughing yoga that I could interview on the show, I'd love to do it, especially, I mean, they don't have to be plant-based, but that would be bonus points. Let me know because I find wonderful things from this show. So if crying is good for the immune system and laughing is good for the immune system, I should be better by now.
We should be healthy, healthy
So
as ever.
but I'm in a pretty relaxed state right now. I'm at the True North Health Center. I'm with my homie, Dr. Alan Goldhammer, who makes me feel he's so emotionally stable. He makes me feel very calm and very hopeful. And I'm with my people here. Like your daughter said, why can't we all live next to each other? Well, why can't we all just live at True North, and have Ramses make our meals every day and have housekeeping do everything? That would be amazing. So I'm not really thinking much about cancer. I have very few doctor's appointments because I'm not here on medical. I'm not fasting because when you're fasting, oh my God, 4 times a day they're checking on you and your blood pressure. Only they do like an intake, just make sure you don't have COVID and things like that. But I find that keeping busy has been really good for me. But I also find that because I have cancer, when I get an ache or a pain, especially the one that I had in my chest last week, I did go to the ER, which was really interesting because the whole time I had pancreatitis, 66 days, and I should have probably gone to the ER and they would have admitted me because the reason I didn't go is I knew with my diagnosis and my symptoms, they would have done right away. They'd put me in the
Right,
hospital. And
right.
that really scared me, the idea of being there, because I tried to manage at home NPO, and they were going to be putting, again, the dietitian said, okay, we're going to put a tube and then we're going to feed you here. And I'm like, oh, it just sounded terrible, you know? So I toughed it out. I probably wouldn't again. I think if I had it again, I would get treatment a lot sooner, or I didn't have any treatment actually. But I started experiencing some pain in my left chest on June 18th, the day after my last Keytruda treatment. Pretty significant chest pain. And I reported it. And so they ordered an EKG and it was normal. And I saw the cardiologist and they said, well, we'll just follow up and do a cardiac stress test and an echocardiogram, which I'm getting next week. It takes like, months to get on the schedule unless something is ordered stat or urgently. And the pain just progressed. And I just thought, okay, well, it's probably just anxiety because I have anxiety. And then I said to my therapist, I said, but it doesn't make sense. Why is the anxiety just here? If I'm anxious, shouldn't it be my whole chest, that feeling? And so it was there. And then last Thursday, it just got so bad. The pain was like a 10. And when I laid down, I got very short of breath and it was hurting anytime I took a breath. And so I got pretty scared and I went to the ER. I think the reason I was able to go is I texted my friend who's a vegan doctor who's the head of the ER. And I said, are you on? He goes, till 9. I said, if I come in, can I see you instead of a stranger? He said, I'll do my best. I think if he wasn't working, I might not have gone, but I went in. I think he fast tracked me because I was there for 4 hours, which like is incredible for an emergency room that busy. And
Hmm.
they gave me room 18. There were like no rooms. Like the people like, they're in the hallway like you see like on a like in
Right.
those TV shows. They're what are they called? Overflow. He got me room 18 and I'm like, ooh, 18, because if you're Jewish, 18 is like, oh, that's like a lucky number, high, and I'm like, okay. But when you go in for shortness of breath and chest pain, they do fast track you. You're immediately you're brought to EKG, chest X-ray, had to get another CAT scan, unfortunately, stat. And I said, look, I really don't want to waste your time and resources. This might be just anxiety. And he goes, no, we have to check it out. And, they weren't upset with me or anything. And they run the troponin, several times to make sure you're not having a heart attack or all that kind of stuff. And so anyway, when he was examining me, he's like, does this hurt? Does this hurt? And he pressed on my chest and I started screaming. So the diagnosis I have is something called costochondritis. I don't know if you're familiar with that.
Yeah.
And apparently it's
Inflammation of the cartilage
yeah. So
around the sternum.
apparently it's right. Apparently it does mimic chest pain from a heart attack. And I didn't know about it. I didn't know I had it. It's not a direct side effect of Keytruda when you look at the Merck website, but inflammation in general, like of muscles and joints, is a side effect of Keytruda because the way it works as an immune checkpoint inhibitor is it's ramping up your immune system. So it could be completely unrelated. It could be related, but because of the location, I was very concerned. And so I had it checked out, and I did well anxiety wise because I kept telling myself I can always leave. The thing that scares me about hospitals, you're so hooked up to stuff, like even to just go to the bathroom, it's like an ordeal there, even if you are allowed because you have the green wristband that you're ambulatory. They're very nice at hospitals, but they're noisy and they're boring, and I don't love the whole experience. So I was happy to go home.
Yeah. And how is it feeling now?
Yeah, it's not as painful as it was, but it's pretty significant. They gave me Decadron, an IV steroid, and that dialed down the pain for a few days, but that has worn off. So they meaning Stanford, the oncologist wants me to go back on steroids for at least a week. Here at True North, they're more holistic, and they're like, well, I think I'm going to have to do something for pain relief because I don't want to go to Vegas and be in pain the whole time. Also, my concern is people always want to hug me, and please don't hug me. Anybody, we'll do a one because that is just like that would really really hurt me right now. They're doing some treatments like with ultrasound and some I don't know, there's whatever. So I think I probably will do that. I can't see the thing is mostly the treatments for most inflammation is anti-inflammatory drugs like NSAIDs,
Right.
aspirin. But because I'm allergic to them, that's not an option. And I find that Tylenol doesn't really help pain. It's okay for lowering fever. So a short course of steroids probably, in the scheme of things, is not, the worst thing that could happen to me. And I will probably do it. Yeah, I feel like doctors must think I'm just the nuttiest nut because I think that most people just do what their doctor says right away. And I'm like, I'm so resistant, but I'm so lucky to have really the kindest oncologist in the world, who, by the way, let's talk about the scan. So
Hmm.
the best word, since you'll be able to report things better than me, juxta
Right.
what these means. But at the end of the day, the thing that was so anxiety provoking is that because the scan was ordered routine, it took 14 days for me to get the results. So from
Mm,
August 1st to August 14, I'm like,
right.
I don't know. So that's the worst part. And but for the most part, it's stable, And Dr. Mayal, that's the name of my wonderful Stanford oncologist, said it might even be improved. It's hard to know because radiologist, you never get the same radiologist reading it every time. And so measurements can be off. Like if it's,
Right.
it can be 21 centimeters, 22, that's not significant. So they don't count that. But I said, well, where's my MET? Because last time I had a metastases, which is how I jumped so quickly from stage 1 to stage 3, seemingly overnight, although it was 2 years. He said anything under 1 centimeter, which is 10 millimeters, doesn't get measured, which means if it's still there, it's definitely under 1 centimeter. Probably my next test will be a PET. I think PETs are a little bit more accurate, aren't they, for cancer diagnoses?
Well, I think that they are helpful as far as metabolic activity. So we can see, like in one of your scans, the metabolic activity went down significantly. So that's helpful to know when that happens, for example. So I like that, and I think it'll show activity in a way that might be can be missed on a CT scan sometimes.
Yeah, yeah.
But that's I think. How do you feel about, like, are you taking that in? Like you're getting
Well,
this stability, right?
I like that it's stable, but I guess I was, I never having had cancer before, or really, even though I've had relatives with it, it's not, nobody ever talked about anything in my family, let alone what they were experiencing. I kind of thought like, okay, I'm just going to get better. Like I'm going to do one Keytruda treatment and I'm cured. And I realized that for some people, they have very little or no treatment, and they have either a spontaneous recovery or remission. And other people, they're in treatment for a long time. So I feel like I'm kind of like on the slow track of of this improving. I mean, it's so much better to be stable than to have growth or spread for sure. So I'm grateful. And they are saying it's the Keytruda. So, we can't just say that Western medicine doesn't do anything, but because apparently it's making the thing smaller, because what else would do that? I mean, unless just, thoughts and prayers in addition could do that. I don't know, but it wasn't without side effects. And I will tell you, I will have been off treatment for 13 weeks before I start again. And I do feel so much better when I'm not having treatment. I didn't realize how sick I felt until I went off it. You know what I mean? Like I was still able to function. I was working through the pain and the pancreatitis, but it's like, I believe Keytruda, I forget the half-life of how many weeks, but when I don't feel great when I'm under treatment, and I only feel worse for people that are having even more strong drugs. Like people are having chemotherapy and Keytruda at the same time, and radiation, and I just can't imagine how bad people feel. And one thing that taught me when going to the ER, it was like just being like in that medical setting with the lights and the noise and the stat and this, and even though my thing was fast track, but there was still like two people ahead of me. One was trauma, one was a stroke, and everything happens so fast, and you're put in these uncomfortable positions, and the CT scan isn't itself painful. It's the position you have to hold your arms, and then when they put that dye in for contrast, that always hurts. And I'm like, if I can barely tolerate this, I don't see how I ever would have been able to do a lobectomy. I don't,
Yeah.
if I can barely, like I said, I mean, I'm the person that was getting, and still, I mean, I'm 65 and I get nitrous oxide to get my teeth cleaned. So I don't think I'm going to be able to do much more than Keytruda. And the thing is, with the very good news is that we have such a nice oncologist. You and me, we share him. He's willing to dose me by weight at the next treatment, and I think that could make a difference. That's Shiloh, everyone. If you haven't met my new dog, his official name is Mr. Shiloh J. Noodleman, Mr. Noodleman, but he goes
Oh,
by.
he's Jewish.
Oh, he's Jewish because his mother's Jewish. Yeah, so he's right over there. And yeah, so I mean, I wouldn't say I'm excited about going back, but I'm happy to try it at a half dose to see if that makes a difference in how well or how ill I'll feel.
Yeah, and I mean, from what we reviewed, the effect, is going to be similar. And it's just when you go above that, all you do is increase chances of side effects. So it makes logically it makes a lot of sense. Was Dr. Mayal pretty supportive of that?
He's so willing to work with me in terms of not only dosing me by weight but also delaying the treatment. So normally Keytruda is every 3 weeks, and I said I feel like that's just too often. He goes, well, how about, and I'm like, well, how about every 3 months? So we came to every 4 weeks, and of course we can always reevaluate. So my next treatment, interestingly enough, is Tuesday, September 23rd, which is the exact third year anniversary of when the nodules were discovered. And somebody's asking for the size. So we're calling the tumor 21 millimeters, the stable tumor. I in my comedy act, I say 22 because I like the number 22, but I think it started at 14, but at one point, I think it didn't go up to like 27 or 28, if I remember.
Yeah, I don't have that number of 27, but yeah, it's been pretty stable. There was one, small little jump, and then there was a little bit of a lymph node that they saw that now they don't see, and the tumor activity is coming, the metabolic activity is down. So all of this points to very stable, if not better. And like we said, if it just doesn't grow, which happens for some people with tumors, especially if you, I mean, think about it, if you never got that initial scan where you found it, you wouldn't know any of this was going on. So I think it's very helpful just to say, great, this is continues to be stable. Whatever it is, it's very slow growing.
Yeah, that's what Dr. McDougall always thought, and he said you'll die with it instead of from it. And the truth is if they were found incidentally, I wasn't looking for them, and I kind of wish I never had discovered them, because now that I know about them having a little bit of OCD, it's kind of hard to never check. I wish I could be like Dr. McDougall, and maybe if I have enough one day, like either enough pain or side effects, and I don't mean pain from the cancer because I don't have any, but I would love to be in a position where I could say I'm done. I don't think I'm quite there yet. I want to give Keytruda a little bit more time,
Mhm.
to see if it's really as good as everybody says it is. And but yeah, there's just so that's what I love about comedy. Like there's just just getting to there's just so much time has been spent on this, and I feel like that there's more fun and more important things to do in life. And that's why I said to Dr. Mayal, I said, look, I got this conference to host and I've got these jobs and I really want to do them and I don't feel well, so I need a break. And he said, yes. Whereas a lot of oncologists, and one that I used to see was like, if you don't get into treatment right away, you're going to be dead in such and such months. And I'm like, that's even if it's true, which it's obviously not, that's not a way to talk to people.
Yeah. I mean, I love the way you talk. I've not met Dr. Mile, but just the way you talk, I wish, more doctors really focused on connecting with the patient and you can give your information, but you don't have to be authoritarian about it.
Right. Well, the fact that he is so gentle and he's willing to talk to my True North doctor and to my primary doctor Nedley at home, like he's just so kind and so not pushy that it almost makes me want to do it because he's so like he says, no, I really want to listen to you and do what makes you comfortable, not what I think you should do. He did want one thing, and I'm going back and forth because I've got to, you think they say that one of the side effects is cancer is getting cancer because you're radiated so much through these scans. And so he would like me to get a brain scan. And I said, why? I had one 6 months ago and it was fine. And he said, well, we like them every 6 months. And I'm like, but I don't want to know because if it's bad, I don't want to know. What are you going to do if it's bad? And he goes, well, you're going to radiate your brain. I'm like, well, no, you're not going to radiate my brain. And one of the things some of the plant-based doctors recommend that are not against Western medicine entirely is that if you're not going to do the treatment, don't do the test. In other words, like if you
Exactly.
know 100% that you're not going to do what the treatment is, why bother doing the test? But they like to know. So I haven't made up my mind yet. And if I do the brain scan and if it's perfectly normal, we're not going to do a show. I mean, I'll put it in my newsletter. We don't have to come on and say, yay, brain scan normal. But that is scary because, being in these cancer support groups, this happens with people with cancer. People I know, they've had breast cancer or whatever, and now it's in their brain, it's in their bones. And I've learned so much just being in this. Oh my goodness. Hey, are we back? Are we live? I am so,
No, I froze or something.
guys, if you can see us and hear us, I, it's funny. The last thing I said, why do so many people have cancer? And it went dark, and I thought maybe I wasn't supposed to say that here, but I think, I think we're still live. Please, guys, put us in the chat if you can hear us again. We're back. Okay, phew. So the last thing I said is why are so many people, including young people and young people that never smoked and people that are vegan, I am seeing so many people with cancer. Maybe it's because that's what I'm going through and I never noticed it, but there seems to be a lot of people with cancer right now.
Yeah, it's 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 concerning that there's just seems to be. I don't know if statistically if it's been measured if there's an increase, but I definitely am hearing about it more. Um, at the same time, me and all my friends are getting older, so I'm not sure if there's a little bias there, but um, I don't know. It's concerning though, right?
Very much so. Very,
I think people's just there's so much toxicity, physical, social, from the food to how people live to, I mean, it's just there's a big burden on our bodies, and our bodies are going to react accordingly.
yeah. I can see myself at a certain point walking away at a certain point if it gets too hard or too painful, you know. One
Yeah.
thing that we're doing is, and I asked him because my body's real sensitive to drugs. And I said, this wham bam, thank you, ma'am, of doing the infusion in 35 minutes. I said, that doesn't work for me. I said, I need some time. And so instead of doing 35 minutes, they're going to infuse it over 3 hours. So that's
Mm.
nice. That gives me my body more time to assimilate it. And they're going to give me a lot of saline afterwards. And I feel like those things are very supportive instead of just, putting it, instead of like a chop shop next, giving some time
Yeah.
to absorb the medication and see. But the thing about Keytruda is if anybody read the side effects that come with it before like going into treatment, I don't think anybody would do it. And they have to do that and probably every drug is like that, but it really can affect every organ and every system. And then, at the end it says blah, 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 including death, you know. So
Yeah. Crazy, right?
yeah, but it is really, one of the things I feel comfortable with Keytruda is all the doctors, including the medical doctors and Dr. Goldhammer, which are very often against most allopathic medicine. Apparently, they've had a lot of patients here that have had great success with their cancers with Keytruda.
Yeah. And I mean, you seem to be, there's certain people that are more prone to side effects. The less than 1%, and then it's like there's certain people where they always get the less than 1%. But Keytruda is supposed to be more tolerable, better tolerated, I would say.
Yeah.
And I think everything that you're doing seems very logical. It seems very clear that it works for you. And I think that's hopefully what people can get behind
Yeah.
is what works for you.
And
Have
hopefully
you find in general people have been supportive
most
from that
people have been
perspective?
supportive. Of course, there's people that think, what I'm doing is wrong. I'm never going to please everyone. But also, there are people who still think I shouldn't have told people that I have cancer, but I feel like, as I talked to the doctor earlier, the psychologist, my 11 o'clock show about healing from pregnancy loss, there's a saying, you're only as sick as your secrets. And it wasn't serving me just to keep it. I kept it for a secret for like 2.5 years, and I was suffering in silence. And so at least now I can suffer the Jewish way out loud, you know.
Is there shame? But did you notice when you kept it inside, did you feel shame?
Well, I felt a lot of shame. Like then here I am like a vegan advocate and telling people to eat vegan and look, it didn't work for me. And what people don't realize that we don't know that it didn't work for me because we don't really ever will know the reason that I got lung cancer. I mean, people often in the plant-based world feel and want to believe that the diet will cure everything, that it's the food, it's the food, it's the food. And while the food is very important, there's something that's even possibly more important, which is your genetics. You can maybe change your epigenetics through diet and lifestyle, but you still are genetically who you are. And I come from a very genetically not healthy family. I mean, there are many people in my family have died from cancer before me. Nobody with lung cancer, but I was pretty much shocked. But I did feel like other people, like, well, if the vegan diet is so great, why did I get cancer? Well, maybe the vegan diet kept me from getting it until I was this age, or maybe it is what kept the tumor small. I don't
Right,
know.
or helped it. slow down the doubling time is what a lot of times when we talk, and McDougall would talk about this too, the doubling time slows down when you follow a healthier diet and lifestyle. So people can't say that this didn't work. I mean, it's just that doesn't even make sense to me that the diet doesn't work. I guess it depends what they define by work.
And, I am doing, I mean, I wish people, I don't, I mean, obviously I can't say, please watch everything I've ever done, but I still get, well, have you done this? I've pretty much done everything, at least in the United States. I mean, look at all these, look at all this. This is all the stuff I swallow. I'm pretty much taking every supplement that everyone has recommended from the Akkermansia to the turkey tail mushrooms. I'm pretty much taking all those. I am taking ivermectin. I am taking mebendazole prescribed by a medical doctor, not bought at a feed store, as well as doing conventional, as well as doing all the emotional work that people said were the reason, not the reason, but that I had to do, like forgiveness and trauma work. So I am really working hard and doing everything, but there's a part of me that if it doesn't like start showing results, I'm going to feel like I did everything and nothing worked. But maybe maybe it's just
What if
like,
this was going to grow faster
yeah,
and I mean, you've essentially kept it stable for quite some time now.
yeah, but it's been a lot of work. Yeah. We don't know. I mean, nobody
Going to
knows.
be easier.
But like you say, I really believe the work you talk about, and I wish Dr. Stephen Cole would have come on the show, your friend that talks about that CTRA response. But when I'm talking to some of the people here with cancer that look amazing and they're triathletes, I do feel like stress is a big component in disease, and whether or not you have disease. And I think that everybody has stress. It's not the stress itself; it's our ability to mitigate it. And some people just do a better job, with it. I think some people are more emotionally, I don't know what the word is, but they can handle stresses better than other people. And I'm fragile, Matt.
Yeah, and it's also how you respond to the world. Something as little as spilling a glass of water. There's, when I remember growing up and it was like, damn it, and someone would yell and someone else would, I have to clean this up now. It's the last thing I feel like doing. And then I remember going with the Lonas family. They'd be like, oh, thanks for washing the floor for us. We needed to rinse it off. So how everything that happens to you, can be seen in many different lights. And I think how you see the world and what's happening to you really affects your physiology, and which ultimately affects how you feel. So I don't know, AJ, were you someone that would take what happens to you and take it in stride, or was it
Nope, I would
no?
take everything personally. It's my
Yeah.
fault. We were yelled at a lot, and it was just, I didn't. I mean, I know that we have mutual colleagues that believe that, trauma doesn't affect our adult life. I don't like to disagree with my friends and colleagues, but I'm going down that path now because my feeling is it's not going to hurt and it can only help. I did that first trauma healing weekend at Rachel's ministry, and I found profound peace and healing. And now I'm going to do a week-long one in Phoenix next month with the same doctor, Teresa Burke. It's called From Grief to Grace. And my feeling is it's not going to hurt. It's like, chicken soup, Um, I don't eat chicken soup, but that's the metaphor. A lot of people feel like when you have a cold or a flu, chicken soup, and because it helps. It's not going to hurt for sure, and it might help. So why not try these things that are low cost, low risk, not invasive medically?
Yeah.
Help.
No, why not? And and you got to make sure everybody's clear that because you're going to all of a sudden you're going to see all over the internet that you're eating and recommending chicken soup.
No, I'm not. Well, vegan chicken soup, which by the way, you can make with jackfruit, and it's absolutely delicious, and it tastes just like
Oh
the
yeah.
real thing. But at some point, I'm backing a little bit away from some of the cancer support groups because I find that it can get really sad, when you get closer to the people and they're struggling, and you want to be there for them, but I think at some point you just got to save yourself first, and then when you're in a good mental place to be supportive of others, that would be a great time, to go back, especially as a success story. Like I have a friend who's 17-year survivor, and it's like that's incredible from lung cancer, and you want to be that, and not everybody is going to be that, and the story is not yet written. And I think that's the thing about cancer is the hard part about it is the uncertainty of the trajectory of the disease. There is no for certain line with everyone, and but that's life. And now I'm getting faced with the reality that that's kind of how life has always been anyway, completely uncertain, and
Yes,
that,
that's, I think
yeah,
that's the point, is that cancer, removes the illusion of certainty that's always been there, but it really puts that in your face a little bit.
yeah,
Even though there's really no such thing as certainty, but a cancer diagnosis really shines a spotlight on the fact that that's true, and it doesn't allow us to live in that illusion that certainty is possible or exists.
absolutely. Well, they say whatever doesn't kill you makes you stronger. So I want to be like Shiloh. Like it's like, look at that. Wouldn't you like to just be like that? You
Yeah,
know,
just get up on the bed, lay
just
down.
like hang out, and he had a very traumatic childhood. He was abused and he's very afraid of most people, but he's doing well and he's loved and
How old is Shiloh?
he's between 1 and 2. We're trying to figure out what astrological sign he is, and we don't know. We're reading all these books, so he's minimum of 1, maximum of 2, and but he is so sweet, and I think that really does help is having pets. I think whatever life throws at you, having a pet is definitely one of the most healing things you can do for yourself. And you still haven't gotten those kids a dog, and they're teenagers now.
I'm not going to let them watch this show. The but here's the dog that was our neighbor's dog that they kept playing with, that they loved, little Rocky. And this is the little Rocky here. Can you see? It's like the size of her arm. And Rocky was actually a rescue, had like three three legs. The fourth leg wasn't working, and he's about this big, and they just love that dog, and so they want one just like that. So we're looking for, he's about 1 or 2, but something in that age range
Well, I
that's
went to
small.
I went to Pet Finders and I said the same thing. I want an adult that's housebroken, sex doesn't matter, and but I wanted something under 20 pounds and his picture popped up and I said, okay, I'll take him.
And yeah, so that's what they want. So we'll have to do it. I think it's so important. I agree with you. It's really good for the body, good for the nervous system,
They
good
should
for the
have
soul.
they should have pets at the infusion center. I think somebody submitted a question for you, and if it's on topic, we'll take it. If not, we have a show with Dr. Weiss tomorrow that he can answer just general medical questions. But well, yeah, it is about cancer, so we're gonna take this one from Christy and you're a doctor, so you can answer it. She says, hi, I have a family history of cancer. Father died at 56 from stomach cancer, caused most likely from napalm exposure. Many in his unit died young of similar cancers, and he was the napalm mixer. Mother died at 80 of uterine and lung. She was a smoker. Brother died 70 of lung, was a smoker. Maternal grandmother died at 85 stomach cancer. Paternal aunt died in mid-50s from colon cancer. I haven't had a mammogram since 2020, and my family doctor is pushing it a bit. I've never had an abnormal test or any lumps. My middle sister had one benign cyst removed. Necessary test at 61 years. Is the test necessary at 61? I've been whole food plant-based from January of 2024. So she's only been whole food plant-based for a year and a half, and she doesn't say what her diet was before that.
Yeah. But you know who talks about mammography a lot is Gilbert Welch. You looked at his work, right? H.
I
Gilbert
have
Welch.
tried to get him on the show. It was 2 days before Dr. McDougall died that I said, "Could you introduce us?" And I never got introduced to him to try to get him on the show. He does have some videos available on YouTube and other formats.
Yeah, he has some great articles. Um, he also has a book called Should I Be Tested for Cancer? And he has another book called Know Your Chances to Understand Statistics, which is very user friendly. The the challenge with mammography is that it picks up cancer that's not going to kill you as well as cancer that might kill you. And it doesn't do a good job of telling the difference. So then the question is, there's people that get cancer. I think the statistics in the Cochrane review, this was an old Cochrane review, was I think it was about 2,000 people over 10 years. And they said that if you get mammography, 10 of people will be diagnosed with breast cancer out of the 2,000. and 9 of them will have cancer that wasn't going to kill you, and 1 will have cancer that would. And all 10 get treated. All 10 of them um, then think that, thank God they got treated because that's why they survived, when in fact 9 of them got treated even though they didn't have cancer that was going to kill them. So they got treated unnecessarily and had to go through chemo or radiation or surgery or all of the above. So to me, when I talk about mammography, it's discussing all of this with patients. There's a Cochrane review, um, like a patient handout that we give them that they can then get that information and then they decide what works for them. If you're not going to get treatment, like you said, AJ, you know, does it help you to know? And then if you are going to get treatment, to know that there's risks and benefits of treatment as well. So it's a bigger deal than just getting it, because people get a false sense of security when their mammogram is negative. You could still have cancer growing in there. It's just too small to see. And when it's positive, it doesn't mean it's a death sentence or that you have the kind that's going to kill you. It's hard. So it creates a lot of challenge. And I think it's a personal decision. So if the person who wrote in is saying that if there's someone that wants to know and is going to get conventional treatment regardless, and it really helps them because not knowing keeps them up at night, then that's fine. Then that makes sense to go one direction. But on the flip side, someone might have other reasons to not go in that direction. So does that make sense, AJ? Where it's really you have to take the information and decide what works best. I think that's what you did with your cancer treatment. Everybody else thinks it's like this, not everybody, but a lot of people think it's a cookie cutter that you have this, do this. And I don't think it's that clear.
Right. So I think that's a great question. If you had information that showed you had it, what would you do? Because if you're going to do nothing, then maybe don't do the test. The thing is, there's other tests that people can do. It's not always just mammography. People do thermogram, people do ultrasound, and there's blood tests now. I had the guy on the show from Detar Genetics. I'm not recommending this, and Dr. McDougall was actually kind of upset about it because he said this is going to result in people being overtreated. But for people that really want to know if there's cancer anywhere in their blood, there's like insurance generally doesn't pay, and it can be anywhere from 800 to thousands of dollars. But you can get a blood test now that will detect cancer in your blood. And I had that done out of pocket because it took a year and a half for me to get an oncologist, and I wanted to know if this tumor for sure was cancerous. And supposedly it's 97% accurate. And it said yes, but then it was a year later that I finally had the confirmation, from the tissue biopsy. So, I mean, the thing is, do you want to know? See, I'd rather not know, but I know now. So
Yeah,
maybe
and McDougall did here. Can I put it in the chat, or am I able to put something in the chat?
you can put it, they won't see it, but I can take it and then put it in the show chat if you
Okay.
like.
That's a link to a YouTube where McDougall's talking to Peter Ghosh, I think is his name, and he is very well known for what he even wrote a handout that I don't think is available anymore, unfortunately, for patients to make informed decision making around mammography. And then here's an article that was written by this guy, Peter Ghosh, that's interesting. And this is their opinion. I don't think you should necessarily just do what this person says, but at the same time, I think you should consider it and think about it before. It's not, here's what I would say. It's not as clear cut when people say, you need your mammogram. You're crazy if you don't get your mammogram. With that family history, you got to do it. I don't think it's that clear cut. I think you can make arguments for and against, and ultimately someone has to help you understand the information and then make an informed decision that works best for you.
Right. That's why it's kind of cool to have, in my opinion, like a doctor like Dr. Sultana or Dr. Natalie, that is a plant-based doctor that's really kind of more of a lifestyle medicine doctor.
Yeah.
So that they're more open to you resisting some of these things. But for me, what cancer showed me is that I had a lot of other stuff that I never dealt with, like my anxiety, like my trauma, because it really shined a flashlight on all these things that and it's not that I didn't want to deal with it, I just didn't really have the tools or knowing how. So I've always been kind of a late bloomer, got married at 35, graduated college at 35. So now I'm just probably doing some of the things that might have been beneficial if I had done them sooner, but really I didn't have the skill set at the time to know how. So I'm just kind of I'm a late bloomer and I'm catching up. Look at him just rolling around. You see, I could just watch him all day. Just see that's healing to me. So yeah, sorry, I don't have any earth-shattering news, guys. It's kind of like status quo, but stable is good. I'd love to come on one day and say, hey, no evidence of disease, tumor gone. I'd love to be on that panel that they have at the Holistic Holiday at Sea. It's the Cancer Survivors panel and share my story. But again, everybody's story is going to be different. Everybody's cancer is different. And I wish it was, like appendicitis where I could just get my appendix out and be done with it. But apparently it's going to be something I'm going to have to learn to coexist with, like my anxiety and, I just realized all my inside out figures on the computer were not brought with me. And I have those little characters. I guess Charles took them off for the transport. So Matt, like, what are your thoughts on the brain scan, like a brain MRI? Like, would you do it if your doctor recommended, or just say, hey, I prefer to wait or not do it at all? Because again, it's just going to make me
I
anxious.
think if yeah, I think if I've decided that I'm not doing radiation, then or whatever the doctor's saying they're going to do with it, I'm not clear why you would get it. And if that helps the doctor, you know, for some reason, I'd love to understand that better, but I'm not going to do something for me that's going to give me anxiety just because the doctors usually do it. And that to me is never a reason to do it. Oh, this is just standard. That's not a good enough reason.
I think maybe they're doing what I call it the standard of scare, not the standard of care, kind of to cover their tuchuses because, this is the protocol in standard cancer treatment.
Well, there's this belief that if you find it smaller before it spreads, well, if we irradiate that or do something to it, we're going to prevent it from spreading. And if you wait longer, there's a problem. So the to me, the data is very clear that by the time it's big enough to see, if it's the kind that's going to spread, it's already spread. We just haven't been able to see it yet. Because if it's the stuff that spread is going to be if it's just big enough to see the main tumor, the stuff that spread is going to be too small to see. So you're going to get this false sense of security, thinking that, oh, we got the one, so now your brain is cancer free. So to me, it's this idea that you got to get it sooner than later. It doesn't hold water in general, but happy to talk to the doctors if they have another reason.
Well, I don't even think Keytruda works on brain cancer, does it? If I did have lesions in my brain, and I'm thinking, well, why would I want to radiate my brain when I'm not even going to radiate my chest?
Well, that's the other thing is that you're very clear that you don't want to do radiation. Radiation doesn't improve overall survival. It's great though if you have a symptom and there's something, because of the size of the tumor, let's say you had a big tumor in your brain that was causing symptoms, and then you irradiate it for palliation to improve comfort. That's a different reason. And I think radiation is beneficial at that point. But radiation to try and make you live longer I need to still see the data on that. And I think when we even talked to the radiation oncologist, they agreed with that. I don't remember exactly, but I think the radiation oncologist, at least that you were speaking to, was very nice and very open about that.
Yeah, yeah, I do. That's the thing. You want to get a good, nice people on your team. Well, anyway, I don't have
So I
anything.
want to make sure it's clear though that I'm not saying you should never use radiation, but I think depending on what you're trying to use it for, that it makes sense, or sometimes it doesn't make sense to me. And getting a brain MRI, like you said, is going to cause a lot of anxiety. And if you're not going to do anything that they are saying you need to do, then why give yourself that anxiety?
Yeah, I mean, I did it once, but just like I did, colonoscopy once. I don't want to do it again. Enough, enough. Got to live my life. Like I have Dr. McDougall's advice on him. Just go live your life. Go live your life.
Yeah,
And
and I think the living your life is key. I think that actually helps the cancer. The Bernie Siegel stuff that we've talked about, living your life, as really, he talks about that being really important. So I think it's all important. I know you also asked, like, does Keytruda help with brain? It depends on the cancer, it depends on what's going on. I think about melanoma and things like that, it's been helpful. So it's get the information, figure out what they're going to do if this is the result, And then if that's something you would do or explore, then it's worth getting the test. But if you're not going to do it, then there's no reason. We used to do that. I remember as a resident, we would keep ordering blood tests every morning. I remember as an intern, and we're taking all this blood from this patient, and the patient was anemic, and we're trying to take, to figure out why is this patient, what's going on. And I remember the attending saying, it's because you're taking blood from them every morning. And he's like, what are you doing? Why are you taking blood? And I say, well, that's just what we do every morning. We order the standard labs because as interns, we didn't really think that far ahead. And he
Funny.
was like, yeah, stop ordering labs and you'll get rid of the anemia. And it was very funny. But he was basically like, you're not going to do anything different. Why are you ordering these labs every morning just because they're in the hospital? So
Exactly.
it's good advice.
Well, I could talk to you for a long time, but it's time to go hear Dr. Goldhammer speak. And by the way, guys, you can sign up for a free account and watch him live right now from the comfort of your own home. I don't know if you realize that, Matt. You can watch all the lectures for free at True North. You don't have to be a patient.
Oh, that's pretty cool, Gowan.
It is. He's been doing it for years, but I get to go see him in person and rim him a little bit. So thanks so much, Matt, for being my rock.
Oh,
And
wonderful, wonderful, AJ. Thank you. And
and guys, check
yeah.
out the links below. Dr. Matt does some great work. He has a wonderful blog. He does wonderful work with couples and people on this thing called nonviolent communication. And I think it's worth checking out.
So thank you, AJ.
Thanks.
We'll
Love
talk
to
soon.
the family. Get a dog. And thanks to all of you. Come back tomorrow, 1 p.m. Pacific time. The doctor is in. Dr. Ron Weiss. He'll answer all your medical questions. And he lives in New Jersey.